Everyone, it's Dr. Wes and Alexis at the West Clinic. We've just had a really nice patient experience, and so I asked Alexis if she would share her story. So, Alexis, our paths crossed, I want to say this summer.
Yeah, it was like around May.
Okay. And what brought you to the office? Because you were not feeling how you are now. Like you had some ambulatory assisting devices, aka was it a crutch or a scooter? I think it was crutches.
It was a crutch, yeah.
Okay, and tell everybody what you felt. Why were you on crutches?
Honestly, I don't really know why I was on crutches. I just all of a sudden couldn't walk one day. My foot was painful and everything just kind of started to hurt more and more and more.
And so for you to move around, it felt better to not have weight on it. That's why you got crutches.
Yeah.
And then what would happen if you tried to walk without crutches? Like, what was the feelings that you had in your foot?
It would start to burn. It would start to feel like a whole bunch of little needles were stabbing at me, and I physically, I didn't have the strength anymore.
And so, you guys, we call that complex regional pain syndrome, where it's just an area that is intense. A lot of times it burns. The old terminology for it was reflex sympathetic dystrophy. And how long had were you unable to put weight on your foot, or how long was it acting up?
Almost 9 months.
Yeah, so a long time.
Yeah.
Not very functional. One of the things that I was excited today to review, I said, "How are you feeling?" She said, "I'm feeling good enough that I start a new job on Monday." And so that's how far we've come in the process. So Alexis, you decided to come here from a galaxy far, far away. I mean, you're not local.
No.
It's a little ways to get to the office. And what made you decide to come to the West Clinic?
Any other doctor couldn't tell us what to do, so we decided to go the natural route, and my mom found this place, and so we decided to see how it would go, see if there was any answers.
And what treatments did we start working with? I mean, there's been several of them, and we've got a really good outcome. So what treatments did we start with you last year?
We started with IVs, neuro treatment, acupuncture, red bed, and magnetic therapy.
And so the goal behind that was all of those is to help the cells to be healthy with the vitamin infusion therapy. Mm-hmm. We want to reset the nerves so that the nerves literally open and close and reboot. And then red bed helps with energy, and magnet helps to literally put little bursts of magnetic energy into the area. We want to charge up the area. What's fun about that is how you feel now. So when I came in and said, "How are you feeling? How are you feeling right now?"
I feel great. I feel a lot better than when I started coming here and before that.
And you haven't had any crutches for, I think, about 3 months.
Mm-hmm.
And I said, "Is there any residual thing?" He said, "No, I'm just trying to get the muscles back to functioning and moving, because for an extended period of not moving them, there was some muscle strength loss." Mm-hmm. And so now we're just rehabbing that. Alexis, a lot of times people learn an important lesson when they get sick or they're trying to work their way through the medical system. And if you were to talk to someone across the street or across the country that's struggling with a chronic health problem or a chronic pain problem that you have, is there any advice that you would give someone that is trying to figure out what's going on?
Don't give up, because obviously it'll get better if you don't give up. And to not be angry with it, you got to be patient with yourself and your body, because if you get angry, then you will get frustrated and you will get a lot worse.
I love that advice, that you kind of need to be on that journey and pathway, and that comparison syndrome of, well, why am I feeling this way where other people aren't? And that just adds a layer of stress that it's easy to say and hard to do, but we don't want people to really, again, give up or think that this is the only way moving forward. So, mm-hmm. Alexis, I am delighted with your progress. Thanks so much for being able to tell your story. IV acupuncture, magnetic therapy for a really painful, you guys don't understand how much pain she was in when she first came in. Like, she literally couldn't put any weight on her foot, and to see that progress over the last couple months and being able to help her get it to a new job next week is just really super exciting. Now our plan for her is to just make sure that she doesn't slide back, and I think we can easily do that with some outside the office therapies. So Alexis, thank you for telling your story. Dr. West and Alexis at the West Clinic. We'll see you guys on the next patient success story.